More lap sponges, come on. Come on, wet it. Spleen is huge.
Working in the ER, I wouldn't say it's cool. I would say it's more stressful. Every second counts. Every second of a delay, the patient may deteriorate further.
If I could give him like 10 years of my life just for like another year, then
I want him to live as long as I do.
I treat the animal as a whole because the body is connected. Everything is connected. Your teeth, your gums, your eyes, your heart.
Over here, right side. So, 6 years old, multiple. Apparently he was stuck against the lift lah. So the harness was on here. Okay. The lift got dragged up.
How many?
The lift.
Quite high up?
Just the lift door height.
Okay.
So it was on top over there for about 30 to 35 minutes lah. Yeah, on scene SpO2 was about in the 80s. We gave him oxygen at 10 liters. Currently highest spin is at 99%.
Every case is different. What comes as an emergency that typically requires ICU, it's really unknown. So you went for a roller coaster. Sometimes you don't have any history from anywhere else. It's a first time consult. They come in and then we almost have to think on the spot. His abdomen is very tense, yeah? Very, very tense.
I think it's because of 6 days not pooping. That's why we are quite concerned.
Yeah. Some cases that come in may not be a true emergency at this current moment. However, these sort of emergencies may quickly turn into something quite critical. Therefore, I think prompt diagnostics would be ideal to find out what's the true cause and we can give the appropriate treatment straight away.
My appetite. If
you give the high dose bread.
So usually for our night shifts, the night vets will come in around 7 p.m. We usually have a few consults that are already pre-booked in between 7 to 10 o'clock.
He has environmental allergies. So allergic to dust, pollen, grass, flowers, things in the environment we can't see.
Around 9 p.m. is when the nurses do a handover of their shifts, transfer of cases, catch up on what's going on in the hospital. Usually for me, I tend to have quite a few emergencies at night, maybe 2 or 3. You said 30, 35 minutes.
He likes to go over it.
Anyway, vitals are all stable, heart rate is good, blood pressure is good, oxygen concentration is good. I'm just going to take some x-rays, okay, just to check whether any fractures or the rib area, because it's a hardness, right?
Yeah.
Okay.
He means a lot to me, so I was very, very scared and nervous throughout the whole time. I want him to be fine and recover well. That's what's most important to me at the end of the day.
Most pet parents, they treat their pets as one of their own. They would do anything for them.
This is a Welsh corgi. He's 14 years old. He has been here hospitalized because of his kidneys. I think everyone in our family just cried or just broke down. So because we've never seen him like this, usually he's quite active at home. I mean, he's seen me in secondary school, then like in my 20s, then I'm in my 30s already. So yeah, it's a very big part of our life. If I could give him like 10 years of my life to him just for like another year, then.
If we try to put ourselves in the owner's shoes, it's more to providing the end-stage palliative care comfort for the patient. Even though just painkiller or sometimes a quiet space for them to spend their time together.
6:30, 6:45.
Keep on fluids, monitor, then the meds, see what time we start, and then we do a PCV tomorrow morning.
Right, good night, guys.
I will check with him if it warrants a comeback for review, and then we'll get back to you.
Couldn't empty the bladder. That's why he feels uncomfortable from time to time.
So our day start from transferring cases from the night team to the day team.
Okay. The plan to discharge is Dr. Lai decide?
Yes, Dr. Lai will decide, and then for further plans on further treatment, check with
also Dr. Lai. Okay.
After that, the doctors will do the roundies.
Hi, good morning guys. Hello my sweetheart.
They will check the hospitalized patient and then they will update us with further treatment plan and any diagnostic tests to be carried on.
Any pain meds instituted?
Got buprenorphine.
Buprenorphine.
After that, they will start their day with consultations.
I love those eyes. His eyes are clear, nose is wet. Wow, teeth and gums are excellent.
Good, trying our best.
Nice, clean teeth. All right, guys, next, come on, chop, chop. Typically, my average day is about 22 to 25 patients a day. 加油! On top of that, I would do usually 1 or 2 surgeries.
That tastes good. The tofu tastes good. Wow, I never tasted myself.
It's mine, it's all mine. I wanted to start a 24-hour hospital because I used to get a lot of calls in the night and I couldn't attend to all of them. And it created a certain amount of stress for me. My idea always was to have a good 24-hour service surrounded by a team of vets with the same philosophy and culture, because I realized that a lot of serious problems seem to occur at night. She has fever? What's the temperature?
39.6. The blood pressure is 144.
There's something wrong in here. So we need to do an ultrasound, urgent.
This morning, 4+, she wasn't well. So once she came in, Dr. Lai says that she don't look good, so she's treating her as emergency.
Dr. Tammy, can we get Dr. Tammy, please?
Put her on drip straight away. Put her in the emergency room, ICU, put her on oxygen. Right now, can you give her a dose of IV Tromil, maybe 0.5 IV for the pain, and give her a dose of polycylic, 3 mils. Wow,
Then after that, left side also have one, and then this one, another one. I think I saw 3.
We just found 3 large masses in the abdomen. She had a very large memory tumor removed about a month ago. Most likely, the original memory tumor might have actually spread. When a case like this comes, it affects our nurses, it affects the owner, the patient itself. He's in end stage. He's an elderly dog, 14 years old. We've given the owner an option. She can take it home, spend a few days with her. We can put a fentanyl patch, which is like a morphine patch, which lasts for about 4 to 5 days. And then she can observe. If she thinks the dog is ready, she can call for a vet to go to the house to perform euthanasia. I don't like to do it. Sometimes you have to. It's not a thing I take very lightly. The euthanasia must always be a last resort. And if it's done, it's got to be done with respect. We don't do it in a clinical situation because they need time to also get over this. They need to accept.
Very brave boy, that guy. Good boy.
If he feels that it's time for him to leave, we are all at peace for him to go anytime.
He's fighting, okay?
He's fighting every time when he goes on a downturn, he just fights back. So yeah, he's a fighter.
Yeah, he's a fighter.
I treat the animal as a whole. It's called holistic practice. That means you look at it as a whole. Everything is connected. Your teeth, your gums, your eyes, your heart.
She's having IBDD, which we call it slip disc. She is still unable to walk. Daddy seems to see some improvement.
I think only Dr. I managed to actually narrow down to the problems. The medicines that she actually given is not so harsh and actually make me believe in holistic way of treatments.
I would have lost him 13-15 months ago, but today he's still here. It speaks a lot of volume about what Dr. Lai and his team has been able to do.
Am I tired? I do feel tired, but it's the adrenaline rush that keeps me going. So this patient has a very enlarged spleen. We've been monitoring for a while. It's dangerous to leave a very large spleen behind because any trauma to the outside can cause the spleen to rupture and to bleed. And they can actually die from bleeding internally. I feel that it's time to remove it.
So this bird was found in a glue trap, and the whole body has glue over it, so it can't really fly. We're just using oil to help break down the glue.
It's okay, helping you, okay?
So guys, are we ready? Incision, timing.
Only concern is that because the spleen, he also mentioned, is a reservoir for blood. So if there's any ruptures or what, then it gets tricky very fast during operation.
Spleen is huge. You can see the spleen from here.
I realized that actually a lot of things they are not taught in school, so it's not always like a straightforward answer.
Okay, don't panic. It's okay.
Basically, you can see I'm trying different things here because, yeah, I'm trying to experiment lah. Can flap the wings now. Now we're using like diluted detergent to wash off the oil.
We've got to work as a team. Slowly. Too many accidents can happen, so I need someone to help me while I'm pulling the spleen out. It's got to be very, very gentle. This is huge. I need more fluid, more lap sponges. Come on. Come on, wet it. Gauze count. All counted for?
Yeah, count.
All right, stitch up. Push down and cut. All right.
Okay. I know, almost done, okay? Almost done. I enjoy my job, especially when I see the animal visibly get better. And when the owners can heave a sigh of relief, like, oh, my pet is feeling better as well.
That's what I look for in vets when I employ them, that they develop compassion, not just for the patient, but also for the owner. Anybody else here? No?
Me.
You're here tomorrow. Oh, good luck.
I'm here tomorrow night.
We'll try not to leave anything for you.
Yeah. Oh, thank you.
Over the last 10 years, there are a lot of negative things about this hospital because we run a holistic practice. People get a wrong idea. They think we practice alternative medicine. I don't. We practice complementary medicine. That means we not only do what we're doing now, but we add on other things as long as it does no harm. So there's no harm giving supplements. There's no harm in doing acupuncture. There's no harm in doing physiotherapy or red light therapy or laser therapy. I mean, these are someone's kid. If this was a human hospital and this is someone's child, would you not want to go that extra mile?